While institutions may use different data systems, certain things are common to patient records the world over. The first page or first entry usually has all the patient personal demographic data, such as the name, address, date of birth, next of kin, and so on. Then comes the general medical background. This includes past illnesses they've had, treatments, and outcome. And finally, there's a section with the day-to-day illnesses and how they were treated, recorded date by date as they unfold. These daily notes also tend to have a pattern. There's the subjective, which is what the patient reports feeling. There's the objective, which is based on the examination findings and lab tests. There's the assessment, which is a summary list of all the new problems, and the plan, which is how these problems will be tackled. A referral letter, however, has a different purpose. It's a different kind of document and should not be laid out in the same way that hospital or clinic patient records are laid out. Such a comprehensive, very detailed layout does not focus a specific reader, your specific reader, on what they need to know to play the specific role. So a letter shouldn't be laid out in the exact way as hospital notes. If you do this in OET, it will suggest to the examiners that you do not understand the purpose of the letter and that you cannot distinguish between what information is important and what information isn't. So let's return you to being the reader. This time, I'll make you an ENT specialist, getting a referral letter for a new patient, a little girl who has sudden hearing loss. You're confident that all the information you need is in there and none of the information you don't want is in there. So now, of the information you need, what order or how would you like this information to be fed to you? Logically, as you start to read, your first question is, what does this patient have to do with me? Sounds rather self-centered, I know, but naturally you want to know which of your specific services this patient needs and why. So ideally you get this information first: patient identity, relevant diagnosis, and the steps you're being asked to take. But note that these three pieces of information are in three different points in the case notes themselves. Patient identity is right at the top. The diagnosis comes after examination and lab test findings. And the decision to refer to you, the plan, comes right at the beginning. But these three bits of information have been pulled together, linked, and placed prominently at the top. Next thing you might wonder is, so what's the background to this? How did the patient get to this point? You might also want to know, is there anything going on that will influence how I treat this patient? And what has been done to stabilize this little girl until I step in and tackle her hearing definitively? So, hearing about this main symptom of deafness, you might want to look for specific symptoms, how they developed, examination and lab findings that support the writer's diagnosis. Now here, you also might not mind getting relevant family and medical history background information. Maybe not in the same paragraph, but close. And why? Because these possibly all relate to this diagnosis of deafness. And in one snapshot, supports your quick picture of what is going on with this patient and possibly why. And again, family history, past medical history. These have been pulled from different parts of the case notes and linked together. The last bit of information then you might want to know is if there are any developments or complication that change the sender's management or sense of urgency. Now in this instance, you may get information date by date, as they are in the case notes or medical records. So say this little girl was treated for an illness, settled down, was well and happy, and then suddenly a week later, she fell suddenly deaf. The time interval between the first and the second illness is important to you as an ENT. So you want to know this and you wouldn't mind getting it in chronological detail. So different scenarios call for different approaches. But from one section to next, you want concise information which is strictly relevant to your role. Main word here is relevant. So yes, this little girl is living with her parents. She has pet turtles and she had an umbilical hernia repair 5 years ago. That's all part of her story, but is it relevant to you, her ENT? No, so you don't want that information in. So I want to switch you back to being the writer for a minute, if I may. Hopefully you don't get dizzy. But I want to use this time to point out that the issues that I just mentioned highlight the danger of using highly formulaic phrases or highly formulaic layout in your letter. One, you give either too much or too little information because the purpose and the recipient of the letter are not really well thought out. You include irrelevant details, 2, and 3, the arrangement of the info in your letter might not actually be the most efficient to convey the information you have to. And efficiency is important. You get an approximate word from OET for your letter. It's usually 180 to 200 words. But OET does not count the letter and will not automatically deduct points if you write more or less. However, if you write double or triple this word count, it suggests that you have too much information in your letter, which in turn suggests that you don't quite understand what's important and what isn't. Conversely, if you have too few words, you write half the number of words, it suggests that there's lots of important information that is missing, or maybe you simply do not understand the language of the case notes themselves, or maybe poor time management was involved. So now in this last section of this tutorial, I'll touch on paragraphing and something we call cohesion. And once again, I'll make you a little dizzy by shifting you back to being the reader again. Now, paragraphs help us English speakers to make sense of information. For us, a new paragraph is like saying, take a breath, we're moving on to the next topic here. So a referral letter you've received with all the pertinent information and related ideas linked in a paragraph, and they flow logically, so they are cohesive, as we call it. But then you see that horror, everything is written in one solid paragraph. English speakers often use the first line of a paragraph to get an idea of gist and the detail within it. We have to work so much harder to scan and pick out gist and detail if everything is in one solid block. Honestly, we don't like it. So a nice rule of thumb is linked ideas in one paragraph, then flow to the next logical paragraph with its own set of linked ideas. So going back to an unrelated example, I must confess, of paragraphing, which we met in Module 1. We see paragraph 1, the patient is asthmatic on routine salbutamol and Bicotide. She developed pneumonia and received amoxicillin as an outpatient. Shortly after starting the antibiotics, however, she developed diarrhea. And it is for the diarrhea she has now been admitted. Paragraph 2, on admission, she was dehydrated. So you see here again, linked ideas brought together in one paragraph, and the next paragraph cohesively flows on with another set of linked ideas.